Dr. Ajay Chaudhuri is the medical director of the Diabetes and Endocrinology Center of Western New York. Dr. Chaudhuri, thanks for joining us today.
Thank you, Mike. Pleasure to be here.
So we've heard an awful lot about the diabetes issue as it relates to COVID-19, and we wanted to talk with you a little bit about that. But first, as people can see, we're practicing social distancing through this video interview. If you can start there, how has your practice changed from a sense of dealing with patients in person versus some of the virtual visits?
So clearly, as soon as the pandemic came to Erie County, we decided that we have to start doing virtual visits, telemedicine visits for the diabetes community, because they are a community, or patients with diabetes, as you know, are at a higher risk of getting complications if they get the COVID virus. So we are doing 99% of our visits now through the telemedicine platform, so we can provide care to patients in the safety of their home.
So let's talk about that. It seems to be a little bit of both fear and the unknown of patients still not wanting to see their physician, whether that is remotely, whether it's in person, or even going to the emergency room if needed. So why is it so important that people are educated and understand that they should not be afraid to pursue healthcare during this time?
Yeah. So the most important thing right now for people who have a chronic disease like diabetes is to make sure that their blood sugars are under control, because running high blood sugars could increase their susceptibility to getting the infection. And we know that if people have diabetes, if they do get the infection, then they could have more serious complications. And so understanding that, I think, and understanding that we are able to provide care in the safety of their home, they should be getting the care that they need for their diabetes. The other important thing is that if they are having a problem and if they need to be seen in person, we can assure them that they will be coming into a safe environment. In the clinic right now, everybody is screened for any symptoms regarding COVID. The temperature is taken. They are being provided with the personal protective equipment like face masks. Our waiting rooms, we schedule so that there is not more than 1 or 2 people in the waiting room. And once they come into the clinic, we assure that every surface that is being touched is being disinfected. And it's critical that people with diabetes and other endocrine problems understand that they can receive care either in the safety of their own home, or if in person, they will clearly be coming into a safe environment.
So clearly fear should not be, a factor in preventing people from seeing their provider. Are there things that they can do proactively so it doesn't get to that point? So are there reminders that, you and your team, your staff are giving out, or even if not during this pandemic, but what are some of the common themes and tips that we have to give diabetics on a year-round basis?
So an important thing right now is clearly, schedules have changed. People are spending time at home. People are clearly a little bit stressed right now. And all these things can affect, the lifestyle that is important to keep diabetes under control. So for example, our dietitian in the clinic has some tips for people with diabetes, as to be careful not to kind of change their schedules, not to bring in comfort foods into the house, so that you're tempted to kind of eat things that you should not be. It's very important to keep your blood sugars under control, so it's important to take your medications the way you're supposed to check your blood sugars. And if you're having any symptoms, of an infection, or if you find that your blood sugars are rising, to get in touch with your healthcare professional as soon as possible, so that we can avoid any hospitalizations. And clearly that can be avoided. Clearly, if it is necessary that you need to get into the hospital, again, I think you should not be fearful, because again, I think hospital is probably one of the safest environments, to be in. I tell people that you will get the infection not from the hospital, but probably from the community.
Sure. So Dr. Chaudhuri, you've been around for a while. You've seen a lot of these public health type issues come and go, whether it's SARS, whether it's H1N1, things like that. Clearly, COVID-19 has been dramatically different, and really has had some grave impact on patients in the community. In particular, probably your patients. How have you had personally dealt with that, knowing that your patients are at risk and your patients have been hospitalized, your patients are in the ICU? How have you dealt with that?
Well, this is something that I've spent some sleepless nights, on this issue, understanding, that people are going to be a little bit fearful, etc. And that's the reason within a week, we decided to change our whole practice so that we are able to provide these virtual visits and to be able to reach out to the patients. Patients who had canceled and rescheduled, we are proactively reaching out to them to make sure that they are okay, that they are doing well, that they have all their prescriptions. We are informing them that pre-plan so that you have enough medical supplies. And I also let them know that if for any reason, if you have to go to the hospital, take your glucose monitors and supplies with you, because it's possible that a family member may not be able to bring those things to you. But I'm proud to say that with our department and with the cooperation of all the staff, within a week we were able to change to a virtual platform and proactively calling people who were not showing up, who were rescheduling, to make sure that that they're receiving appropriate care.
Sure. So in closing, as we wrap up, I think the message here for you, it seems, is that you want to make sure that the viewers, those who may be diabetic, that there's an educational component to this, that it's okay to come to your clinic if needed. If not, please make sure you have a virtual visit scheduled. Don't avoid the hospital. It is a safe place. So more of, it seems like from you, it's we'll get through this together type message. What's your parting comments for us today?
Yeah, you've summarized it very well, Mike. We want to let everybody know that we are open. We are there to care for you. If you're already a patient of ours, just remember that we are here to support you in every which way we can. And if you are a new patient who needs specialty care, please contact our clinic and we will be happy to provide that care with you, care for you and take care of you during this time.
That's great. Dr. Ajay Chaudhuri is the medical director of the Diabetes and Endocrinology Center for Kaleida Health. Doctor, thanks for joining us today.
Thank you, Mike.